Welcome everyone to this short presentation today on the Rheumatic and Musculoskeletal Diseases Unit here in Our Lady's Hospice and Care Services. This presentation is designed to give you an overview of the range of services provided within the Rheumatic and Musculoskeletal Diseases Unit, or RMDU. We are directing you to our new RMDU patient booklet, and the link is attached here for you to view or download if you wish. Arthritis can have a significant impact on a person's ability to function in everyday life. Musculoskeletal disorders are the most common reason for work absence in Ireland. You might be surprised to know that the average age of patients at the onset of inflammatory arthritis is in the 40s and 50s, with many patients developing inflammatory arthritis much earlier, including in childhood. In the RMDU, we strive to provide high-quality care for our patients, and we believe they will benefit greatly from their treatment programme with us. Over the years, we have positively affected the lives of a huge number of patients and their families. Our experience spans over 50 years, and our services and facilities have developed over this time to reflect the advances in rheumatology. Some of you may remember the unit as St. Joseph's. The name was changed to the Rheumatology Rehabilitation Unit in the 1990s, and it is now known as the Rheumatic and Musculoskeletal Diseases Unit, and the name change reflects the modern approach to managing complex rheumatic diseases. We are one of only a small number of centres in the country that specialise in the care of rheumatic and musculoskeletal conditions, disease and symptom management, and multidisciplinary rehabilitation. Our aim is to empower individuals with arthritis to improve their general health and well-being, maintaining function and independence so they can continue to participate at home, school, college or work, and life in general. Our goal is to facilitate a shift from surviving to thriving. Our service has changed over the years, and in addition to inpatient 5-day treatment, we now provide day case and outpatient services in line with our patients' needs. We have no upper age limit, and we can also support young patients as they transition from paediatric into adult services. We treat over 1,000 patients annually, and whilst most of our referrals come from St. Vincent's University Hospital, we also accept referrals from St. James's and Tala Rheumatology Services. Due to the expertise within our unit, patients may be referred to our consultants from other parts of the country for specialist treatment, if deemed appropriate by the referring consultant. Providing access to early diagnosis, multidisciplinary clinical expertise, and early intervention prevents or minimises irreparable joint damage so commonly associated with arthritis in the past. Targeted therapies have revolutionised the way we treat a variety of rheumatic diseases. But it's not all about the medications. By educating the patient, we can empower them to become effective self-managers, which is an essential component of disease control. Self-management skills support the individual with arthritis to remain as independent as possible, as well as enabling them to recognise when professional help is needed. And we can also provide family support when needed. Care in the Rheumatic and Musculoskeletal Diseases Unit is delivered by our highly skilled multidisciplinary team, led by consultant rheumatologists from St. Vincent's University Hospital. And this team includes specialist registrars and house doctors in training, as well as a visiting paediatric rheumatologist. Nursing and healthcare assistants. Nursing includes generalist, specialist and advanced practice staff, including nurse prescribers. Occupational therapists, physiotherapists and physiotherapy assistants, medical social worker, dedicated clinical pharmacist, additional clinical services including podiatry, phlebotomy and radiography, and non-medical support is provided by administration, household and catering staff, along with volunteers, educators and chaplains. What is unique about our service is the multidisciplinary programs of care and rehabilitation, including hydrotherapy, for patients with inflammatory arthritis, for example rheumatoid arthritis, degenerative arthritis, such as osteoarthritis, and chronic musculoskeletal pain syndromes. Access to clinical nurse specialist and advanced nurse practitioner for patients with more complex rheumatic diseases. Assessment and rehabilitation programs for less common rheumatic and musculoskeletal conditions, for example, systemic sclerosis or vasculitis. A nurse specialist-led rheumatic reproductive health clinic. A service for young adults with rheumatic and musculoskeletal diseases. And being at the forefront of clinical education and research enables us to constantly improve our programs of care. We are the only service in Ireland offering university-accredited rheumatology education for nursing and the multidisciplinary team, and we have education links with several acute hospitals and universities, including UCD and Trinity.